When someone has a serious medical situation or injury, you know it's best to just get them to the emergency room. But what about mental health or emotional distress? That's when things aren't as cut and dry, but you want to find the appropriate place to get help that person may need. We've got Carrie Mull. She's the Administrative Director of Behavioral Health for Trinity Health West Michigan. Kristen Spikerman is the Chief Clinical Officer at Network 180. Ladies, thank you so much for being here. Appreciate it.
Thank you.
Yeah, thanks for having us.
Let's start with those critical incidents. When is it best to just get to the ER when you're dealing with emotional or behavioral health?
Yeah, that's a really good question, because what you don't want to do is try to figure out where to go, and then you might not get help at all. So we don't want to do that. So when in doubt, if you can't figure out where to go and you're thinking, I saw that person on TV and she said to do this, don't worry about it. Go to the ED. Go to the emergency department when in doubt, because we want you to get help. Is that the best place to go for a behavioral health or mental health crisis? Not necessarily. We have resources now that we didn't have in the past. So in the past, we would say, go to the ED. But for people that are having issues with anxiety, like you haven't slept for a few days and things are getting really bad, or you're struggling with depression, or even suicidality, there are other resources that we're going to talk about that are not necessarily best served in an ED.
Okay, perfect. And that, Kristen, that goes on to you. So let's talk about some of these other alternatives that are out there to help people who need it.
Yeah, so in May of 2024, we opened a Behavioral Health Crisis Center, so in collaboration with Trinity Health. And that is a 24/7 place that individuals with any type of behavioral health crisis can walk into. So there's a walk-in area, as I said, 24/7. You can come in with any type of behavioral health crisis, and you can see experts in mental health, in psychiatry, nursing, and then you can also stay in what we call our CSU, which is our crisis stabilization unit. So if you have, an issue where maybe you're feeling depressed, or you've lost a loved one recently, you feel like you want to talk with somebody, you can talk with somebody for a few hours. Or if you need to stay a longer length of stay, there's a 16-bed unit that's secure where individuals can stay for up to 72 hours. And we also have a secure law enforcement and EMS drop-off in the back where individuals can be dropped off if they're in a crisis and need that expert help.
Okay, wow, that's what a wonderful resource. And I think, but sometimes if people are in a situation, they don't know what they want or where they should go, right? And there's a couple of numbers they can call as well. Obviously 911 for emergency, but 988 is also a resource. Let's talk about that.
Yes, so we think about when you're having a hard time with depression, anxiety, sometimes you just need someone to talk to, right? And now we have 988. We've always had 911. That's been drilled into our heads since we were a little kid. Call 911 for all emergencies. And you can still call 911, of course. But if you're struggling with a mental health issue, 988 is really what you should call to talk to an expert specifically designed to help you with that issue.
Right, because they will know where you need to go or what other assistance you might need. So let's talk a little bit about Kent County's 24/7 Mobile Crisis Center, what that is and how that can also play into this.
Yeah, so what we want is for people to have a place to call. So call 988 for a place to call. We want them to have someone to come if they need somebody to come directly to them, which is Network 180's 24/7 mobile crisis response teams. And so our mobile crisis response teams, you can call Network 180 at 616-336-3909 any time of the day or night, and we can send a mobile crisis response team to wherever you are in the community. So this is for children, for families, for adults. And then the place to go would be the Behavioral Health Crisis Center, which is at 260 Jefferson Southeast in Grand Rapids. And that is also open 24/7, and that is for adults who are ages 18 and up.
Okay. So someone's at home and they're having an issue and they say, this is what I need. Do they call 988 for that, or do they call 911, I guess? What should someone do?
If you accidentally call the wrong number, that doesn't exist, right? Because if you call 988 and the 988 person on the other end of the phone says, this is more of a medical issue, they'll transfer you right to the 911 operator, and vice versa. If you call 911 and it's more of a mental health crisis, no worries. They will transfer you right to the 988 operator. So you really can't go wrong.
There you go. And any other indications that people should be aware of to be like, okay, this is when I need to make this call? Because I think sometimes people think, oh, this is going to resolve itself or it's going to be okay, and then it doesn't. Is there any indication, anything that people should really be thinking about?
I think what we want is for people to lean towards calling. If they have any question, then call, and we can get you to the right place. So any one of these resources is available 24/7, and we'd rather you call sooner than later and wait for the crisis to get worse. So it doesn't matter how you define your crisis or how little you might think it is. It's still important, and there's people to help you.
Well, we are very grateful for that, and that's such crucial information. Ladies, thank you so much for being here and for sharing all of this. You want to learn more about either Trinity Health, there you go, trinityhealthmi.org/behavioral health, network180.org, 988lifeline.org. But of course, if you're having an emergency, 988-911, those are the numbers you're going to want to call to get the help you need. We'll be right back.